Hi Simon, so what can we do for you today?
Well, I think I need an HIV test. I talked to somebody I had sex with a couple of months ago, and he's just found out that he's positive.
Okay.
And we didn't use condoms when we were having sex, so I thought I should just come in and check.
All right, and have you had a HIV test before? Is this your first test?
No, I had one before, but that was years ago.
Okay. Have you been concerned about any other risks in the time? Or?
Yeah, I suppose I have. I mean, there has been quite a lot of unprotected sex, I guess.
Okay. Is that something that has bothered you? Have you actually thought, I'm putting myself at risk of HIV here, or have you thought...
Well, not really, no. I mean, I think it's only really since he said something
Okay.
that it kind of comes to light. Because you kind of think to yourself that people would tell you.
Yeah, fair enough.
So
yeah.
I just always kind of assumed that everything was okay.
So that's kind of your sort of way that you've been looking after yourself, is just to make that presumption that if someone had HIV they would inform you, which of course this guy has, but unfortunately he didn't know at the time that you had sex with him. Did you or do you know whether he's been infected for a long time himself?
I didn't ask any more.
So you don't have any more information?
And he was quite upset, so I didn't want to talk to him anymore.
Oh, that's fair enough, yeah, quite reasonable. How are you feeling about it?
Nervous.
Okay.
Yeah, very nervous.
Have you talked to anyone?
No.
Can you talk? Is there anyone that you can talk to?
Not really, no. I'd rather not.
Why is that?
Well, because it's difficult. I don't really talk about things like that to people, really. It's kind of quite a difficult thing to talk about. It's quite private.
Oh, yeah.
So I don't...
Yeah. But you don't have any confidants, any members of your family who could be supportive?
No.
I guess what I'm thinking about is if the result was positive for you and you're feeling nervous now, whether there would be anyone who could help you or support you through that.
Yeah, I hadn't really thought about that. I mean, if it came to it, I suppose there are some friends I could talk to, but I don't really want to.
Okay, yeah. So you haven't really thought about it being positive, or you mean you hadn't thought about what?
No, I have thought about that.
Okay.
Yeah.
What's your feeling about it?
I'd rather it wasn't, obviously.
Yeah.
And it scares me because of the future, and I don't really know how would cope with it and what it would really mean. I think it would just be really difficult. It would change everything.
What are you like at coping with things generally? How have you been in the past?
Well, I've not had anything kind of this serious happen.
Right. Anything that... I mean, do you feel that you have coping skills?
Yeah.
Yeah.
I think, in the end I would manage it. I don't think I'm going to kind of jump under a bus or something like that.
Right, okay. Good. So you feel like you would manage it,
Yeah.
but you're just understandably nervous.
Yeah.
Is there anything you want to ask about it, before you go ahead and have the test? Because you said you're concerned about the future. What is it about HIV that you're most worried about?
That I could die young, that I would have to take tablets all the time.
Right.
People won't want to go out with me or have sex with me anymore.
So quite a few things then, isn't it, that you've been worrying about? Do you know anyone with HIV? Do you have any friends with HIV?
Yeah, the bloke the guy I had sex with.
Yeah.
I mean, that's the only guy.
That's the only person you know?
Yeah.
Okay, so you've not experienced, what it's like for people?
No.
I mean, of course, it's quite possible that you may have friends who haven't told you their status. It's possible that you have friends that are positive and are just leading a normal life. Or do you feel that would be unlikely?
It could be possible, couldn't it? I mean, I didn't know that bloke was.
Yeah. Have you heard much about treatments or...
Yeah, I know you've got to take it, and you have to take it all the time, and it's for the rest of your life.
Well, as far as we know, obviously that's something that changes, as research comes along. But the treatments for HIV are very good, and which is why I mentioned that it's quite possible there are people just getting on with life that you don't know have got HIV, because in my experience, the patients that we have tolerate the treatment very well, and they just carry on as normal and go to work, as normal, and are really able to manage it. So in terms of the future, I think, I don't feel that you should be thinking, I can't plan my future, because in fact you
And
can.
then what would happen if it was positive?
Well, what we like to do is firstly confirm the result to make sure that it is positive, and then we'll do tests to really look at how much virus is present in your bloodstream if the result is positive. Right. And that gives us more information about your state of health and gives you information, which is what enables the doctors to think about whether you might need treatment or not, because some people don't need treatment initially.
Okay.
How do you feel about all that? It's quite a lot to take on, isn't it? I can see you're thinking...
I just kind of want to get on and do the test.